I'm Sam the Man. Welcome to my study. I am an independent health broker for Medicare in the state of Texas. We're going to pick up where we left off last week and go into more detail on Medigap, or Medicare Supplemental Insurance. So remember, we started with original Medicare, the red, white, and blue card. Okay, it had A for hospital and B for medical. That's all it covers. That's original Medicare. To that, we want to add a Part D drug plan. In addition, to cover the holes in Medicare, we're going to look at Medigap Supplemental Insurance. This is private insurance from an insurance company, just like car or auto, and it's overseen by the state insurance commissioner. Our other option we talked about last week is Medicare Advantage. The main thing about this is you are taking your original Medicare and turning it into an Advantage, where an insurance company is contracting the doctors and handling everything. With the supplement, your original Medicare stays in place. The supplement supplements. So we're going to have to go into a little bit more detail about what Medicare pays. Okay, bear with me. Okay, this column is 2019. We're not going to go by that. We're going to look at 2020. So when you go in the hospital, which is Part A, you have a deductible of $1,408, $1,408 for your stay. If you're in longer than 2 months, in other words, the $1,408 gives you 2 months. After that, the third month, you pick up a daily copay of $352. After the third month, you're done. You've only got a couple of months of lifetime reserve. So that is your Part A and what you have to pay, and it's the deductible, because most people aren't going to be in the hospital longer than 2 months, hopefully. Now let's go to Part B, which is your medical. We have to pay $144 a month. I'm rounding it off. If you made really good money, you will pay more, but that's not most folks. On your Part B, at the beginning of the year, before they pay in that 20%, you have a deductible of $198. That's one time per year. After that, they pay that 20% you would normally have to pay. Okay? And high deductible plans are different. We're not going to get into them. This is what most people look at right here. So now that we know what Medicare actually pays, let's look at the supplements. There are a number of plans. They all go by a letter. A G with one insurance company is the same thing as a G with another insurance company. The only difference is the price. Okay, so these things are rated by zip code, the medical cost in a zip code. So whereas somebody in Austin might pay $100, in San Antonio it might be $130, because there's higher medical expense in that zip code, which is also the reason why the cost will go up over time. Your policy stays the same, does not change, but the price goes up. So we're going to look at just a few of them. And F pays everything. Okay, so your A deductible, that 20% you pay on your medical payments, hospice care, skilled nursing, your Part B deductible, also excess charges. Now what does that mean? Let's say you go to a surgeon who says Medicare doesn't pay me enough. This is the price. The supplement will pick that up on just 2 of the plans. There's also emergency coverage out of the country. They will pay 80% of emergency coverage up to $50,000 of the bill. So my particular preference is G. On the F, a lot of people always bought it because it paid everything. It was quite a bit more expensive. But if your Medicare started January 1st of this year, you cannot get an F. If your Medicare started before January 1st of this year, you can get an F. or switch to it. And remember, with the plans, you can switch. There's no time where you have to enroll or disenroll. It's not like an Advantage. The only thing is, they will want to underwrite, meaning they will ask you health questions. If it's a yes, everybody like you pays that price. If it's a no, they're not going to let you in. So let's look at the G. It's the most popular plan right now. That's because it pays everything except for one thing. This little space right here is for your Part B deductible. And that's the $198 right here, your Part B deductible. All of these other costs are paid for. And remember, with the supplement, you can go to any doctor anywhere in this country who accepts Medicare. So yes, you're paying some money, but you've got ultimate freedom. You don't need referrals. You can go to who you want to go, when you want to go. Now, this might be very important. If you're here in Austin and you want to go to MD Anderson Cancer Hospital, well, it's no problem with the supplement. If you have an HMO Advantage here in Austin, you're out of luck. Can't go down to Houston and get regular care. One other plan that some people like is an N. An N doesn't have the B deductible. It doesn't have the excess charges. It's considerably cheaper, and it looks like it's a great deal. However, you see these stars, you have a $20 copay when you go to the doctor. Okay, $20. Well, not like the retired officer in Seguin, Texas I called on who had kidney failure, and he was seeing a doctor 3 times a week. That's $60 every week. A lot more, double what he was paying for his N. So I caution you on the N because you will have some copays. Your Medicare supplement has been around for a while. It was the original alternative to supplementing your Medicare until the Advantage came in early part of 2000s, right in there. I like the Part G myself because I like to travel. My RVers, I normally recommend a Part G unless they can get an F. So anywhere you're going, you can go to any doctor who takes Medicare. It's that simple. It is going to go up over time. That is a factor. You will also have to buy your drug plan. And there's a whole slew of them, but you buy one and then you go, if you need drugs, you have a Part D. Okay, remember, if you don't get the drug plan, the day you do get one, they will penalize you for every month you didn't have it, and that will be tacked on to your monthly cost forever and ever. So, we close with this. Original Medicare, which has the holes that need to be filled, the drug plan, and the supplemental plan, which comes up here and supplements original Medicare. So you are showing your original Medicare card and your supplemental insurance card. It's got to the point now with many of the companies, they have electronic billing. So you only have to show that supplement card once. After that, Medicare picks up the bill. They automatically generate the bill to the supplemental insurance company. I am an independent health broker in the state of Texas. If you are not in the state of Texas, I cannot help you because I'm licensed only in this state. I work all over the state. I do all plans, including dental plans. You can get a separate dental plan. This is a little bit about me. My phone number, 512-971-7011. If you might have noticed, I have a palsy in my hand. I cannot type very well at all. I prefer a phone call. It's quicker. I can quickly ask questions and isolate what your needs are and what plan might suit them. It is all about putting the pieces of the puzzle together to make sure you get the health care that's right for you. I want to thank a couple people. First of all, Chainsaw Leon, my buddy, who's filming this, an up-and-coming filmmaker in the city of Austin. I want to thank my sister, Randy Southard, who's always encouraged me. She's a performance artist at the phenomenal Indra's Warehouse. My daughter, Sedona Joint, a good saleswoman already at 23. And then, most of all, my grandson William, who continues to teach me that it's important to play as often as you can. And of course, his idea currently is asking about Christmas presents all the way in September, but that's him. Thank you for coming. God bless.